Good morning, everybody.
Hello,
everyone. We'll just give it a few minutes and let some people join, and then we'll start the webinar. Okay, we've got a few attendees joining now. So
good to see people rolling in.
Hope you've all got a coffee. It's cold. Get a coffee to keep you warm if you haven't got one. So let's make a start then. So good morning, everybody. First of all, some disclaimers. We have dogs and children around us today. So if you do hear any noises, do not panic. We are managing our situations as we speak. But first of all, let me introduce myself. I'm Gemma, and if you haven't been to one of the webinars before, I am the business development lead for My Learning Cloud. So we are here to speak today about all things digital and integrations. So Gemma, would you like to tell everybody a little bit about yourself?
So I'm also a Gemma, but with a G, not a J. Gemma Ordage, and I'm head of marketing for Unique IQ. So we're a software provider that delivers products and solutions to the home care market.
Perfect. So you may be wondering why we've got you all here today. And basically what we're going to do is we're going to do a quick conversation about what our products do. Some of you are existing customers of either Unique IQ or My Learning Cloud. So My Learning Cloud, as you will know, is an LMS system with e-learning for the health and social care sector predominantly. We do support other sectors, but currently our main market is the health and social care. I'm going to lie, it's a passion of mine, so I always concentrate on that part. And it's all about compliance and ensuring that the content in our e-learning is tip-top and that our LMS ensures easy reporting, promotes compliance within your team, and just does that automated digital work that really takes away the time and effort from you guys, so the automated emails, etc. So Gemma, what about Unique IQ? What is it that your system does?
So Unique IQ, we were founded back in 2006 by David Lyons, who's still very much part of the business, under the guise of using technology to fix business problems. We've been active as within the home care sector for over 12 years now, much like My Learning Cloud. That's our key sector. And we've actually got some clients who are reaching their 14th and 15th Unique IQ birthdays because they were with us before the focus. So our product can kind of be split up into essentially 4 key areas. So it helps you plan, deliver, monitor and manage your care business. So right from the very beginning, managing your rostering, your scheduling, your carers, best match them to your clients, through to delivering the plans that you need to from a care perspective, managing all the medications, the tasks, anything to do with care. You can monitor it because it's real time. So when your carers are out in the field, they use an app to kind of clock in, clock out, log anything, and it's all real time. So you're able to do that as and when any changes come in, enabling you to be really responsive. And we've got one of the largest reporting systems as part of our core product, which enables you to get an access to a huge number of reporting templates, but as well as building your own. So basically it's the backbone to like our home care clients, and it can be personalized to tailor in with the language, the culture and everything else in between. So yeah, it's a big product, but it's continually growing with our customers.
Perfect. And I've seen the product. I know me and you were on a call and we were sharing all of our products and what they do. And from somebody who worked in the health and social care sector, for me, you could really see the benefit of it, of how that would work. And I think, you know, the big thing at the moment is definitely systems on the go. So being able to access, like you said, live, similar to My Learning Cloud, where we've got that app and you can log on and do your learning on the go. Not only is that beneficial across every sector, but especially with health and social care and definitely kind of your domiciliary and home care services, it is about that saving time and money, and just making sure that, you know, if a client has gone out or their family have come to get them or anything like that, that person can log that immediately. So you make sure that, you know, in that case, everything's live. But also if they wanted to, they could do some training. So what brings our systems together, and the amazing thing about our systems, is that within Unique IQ, as part of your rostering that's built into your system, that actually is dependent on what people's training is. Is that right?
Yes. So you can only, we've got a best match feature, so you can match your clients with your carers. So it's not just about your qualifications, but you can also match personalities, backgrounds, interests, and things like that. So it's really important to ensure that all of your data and information for your carers is completely up to date to be able to deliver the care that you need to do.
Absolutely. And that's what's so important, again, is that person-centered care. So not only about, like you said, personality traits and interests, which would make somebody maybe a preferred member of staff for that individual, but also making sure that that competence and confidence is there in terms of the individuals they might support, because of whether it's somebody with you know, for example, dementia, and you know that they've got that training and they've gone through maybe a specific qualification and or just done the training that is required of them, you can make sure that the people going in to see that individual are prepared. Like I said, it's all about confidence and knowledge when going in to support people, and ensuring that we are sending in good quality carers to support those that basically are the most important at the bottom line there, and they are getting everything that they need from the people that we send in. So with that in mind at the moment, as you can imagine what we're alluding to, but training is a massive important part of this rostering system and how it works. And something that we've been working with Unique IQ is actually an integration. So we're very excited, and we're going to talk a little bit about how this can work for you guys and what it can do in terms of saving time and money, and also, you know, human error. I've been there before where you're doing your rota and you haven't got all of that information at hand to make sure that you are putting the right people with the right support workers, with the right individuals that you're supporting. So talking about solution-based thinking, we have come up with a solution, which is very exciting. Gemma, did you want to talk a little bit about that from your end?
Yep. So as Gemma has been saying, it is strange to keep saying my own name, but it's actually you. So as Gemma's been saying, ensuring that everything is integrated and efficient and avoiding duplication, especially with all the business challenges that small businesses in particular are being hit with when you think about some of the external factors such as national insurance, driving efficiencies and streamlining processes where you can still deliver excellent care but remaining as profitable as possible is probably the goal for 2025. And so Unique IQ and My Learning Cloud, they make a lovely blend together. Both companies stand for similar things. We want to achieve similar goals, and we also have like our customers at the heart of everything. So what within this integration, how it will work is if you're both clients of Unique IQ and My Learning Cloud, if you get a new carer, you would add a new carer on to your care management system as you would normally, without you then having to do anything, because you've already subscribed to My Learning Cloud and everything is already up and running. That information would get fed to My Learning Cloud without you having to do anything. It would then be passed over to Gemma and My Learning Cloud, and they would do their thing in terms of setting up all of the different elements to do with new starters. So what sort of things would that cover as once that information has come across to you, Gemma?
Absolutely. So as you guys know, if you use My Learning Cloud already, we have our learning journeys already set up, which is dependent on your role and or location of that member of staff. And as Gemma said, what will happen is you would add them into Unique IQ as your HR system, and that learner would then come across to My Learning Cloud without any need for human input. And that information would come across beautifully. And then with that role and location that you've entered into the HR system, your workers' skills audit will automatically be generated for you, as it would be if you added an MLC, but that's done automatically for you. The beauty is, as we alluded to earlier, is that one of the great bits about My Learning Cloud and Unique IQ is that it is all about competence and confidence of the people that we support, and always giving a really high quality care at the end of it. And with that comes training. And as you well know, people go onto our system and they'll do all of their training on there. And in Unique IQ, there is an area where you can add that. But now what will happen is all of their completed training will be fed back into Unique IQ. So what we spoke about earlier in terms of rostering based on training and based on what skill set these individuals have, that will now come across for you. So that is the title of the training and their due expiry date. So if they do go into their expiry, great, you're going to have an alert through Unique IQ kind of saying that, you know, they're rotoring, they're not suitable for the individuals that you said that they must have that training for. And MLC will still do its automatic emailing out to you, just explaining that obviously you're due for renewal and letting your managers know which members of their team are due for it. So what this does is basically minimise that need to be checking on staff. It will automatically tell you there's two systems talking to each other two-way. And me and Gemma will both admit we're not the techie ones, but we know it does do it, and it does it very successfully. And it's magic as far as I'm concerned, but I'm sure there's more codey words that I could be using. But basically, yeah, so the information would come from Unique IQ into My Learning Cloud, and then all those training records would go back over, just really promoting that seamless digital approach to care that we are wanting to roll out and support everybody with at the moment. So obviously, you may be a customer of My Learning Cloud and Unique IQ already. If you are, then this feature, get in touch. This feature is part of that package now if you are a joint customer already. If you're not, and you're looking at, if you're an MLC customer and you're looking for a new HR system and this integration sounds something that's really of interest for you, then please get in touch. And the same from Gemma, I'm sure, if you're Unique IQ and looking for an LMS system. Again, we've got some introductory offers if you want to get in touch with us and, you know, explore this conversation further. We'd be happy to have those conversations. We've also got some introductory offers. So, you know, grab it while you can and speak to us. But this is a partnership that we're really excited with taking forward and getting that customer feedback, isn't it, Gemma?
100%. I think both companies, our products have grown with the help of talking to our customers, and that's something that isn't going to change. We know that the care sector as a whole is moving away from trying to be silo based from a software perspective, and integration is becoming key. When you think of the things like GP Connect, it's encouraging systems to talk. So it makes complete sense to have two key systems talking to each other just to save you time and money. But we appreciate that from an efficiency perspective. We do appreciate that. Obviously, you're probably thinking, why are they saying this? We need the proof. And so our next steps, just to let you know, is another webinar will be planned in where you can hear from our joint customers, and we'll be able to share physical savings and stats and things to show you exactly what benefits by using two systems that talk to each other can bring.
Absolutely. Everything that both of our organisations does is about supporting the organisations and ensuring the best quality service from both sides. So be rest assured, if you get in touch with myself, Gemma, one of your account managers, depending on whose customer you are as such, then we will absolutely support you through all of this and help you through that process of making sure that everything is seamless going forward for you. But it's something that's really exciting. And like I said, when I used to work in care and managed services, I would have been like, this is amazing, please. So I wasn't using all different systems. So it is absolutely something that I think is exciting, and it is something that will change how we work going forward. And hopefully we can absolutely make this something that is easy for everyone to take on and implement into their workplaces. Is there anything else from you, Gemma?
I don't think so at this stage. We're just very excited to kind of get going and the next one, the next webinar will be great to see it in practice and the true impact of it. But we're open to any questions if you used to send them through. More information will be coming from both of us, won't they, over the coming weeks? So we'll be able to kind of keep you updated with how the partnership's going and any key findings that we have. So yeah, it's the start of something very exciting, I feel.
Absolutely. So we will be in touch with everybody from today. If you do have any questions, of course, also feel free to reach out. And yeah, we look forward to bringing you another webinar soon with that kind of data to show exactly how it's working, exactly what successes we've had from it, and just sharing the experience as we go through it. Wonderful. Well, thank you so much for your time, Gemma. Thank you, everybody, for attending. As I said, we will be in touch for any questions. Never hesitate to reach out. Thank you so much, everyone. Enjoy your day.
Thank you all. Bye.
Bye.
Bye.